Well, depression, unfortunately, is a really common sort of difficulty these days. And 1 in 4 people will significantly experience depression at some time. Little lower for men, 1 in 6. But yeah, so depression, how does that differ from normal sadness? Depression, I suppose, is a syndrome of symptoms that tend to hang together in the presentation of people who are depressed. And that is the mood sorts of symptoms. So you've got this low, flat sort of heaviness about you, where there's a sense of a bleak sort of outlook on life, and difficult to actually find energy or enthusiasm like you used to before. So they're the mood symptoms. Your emotions might flatten right out as well, or they may become very sensitive. You become acutely sort of aware of the things that you're feeling. So one or the other. So the presentation can really vary from person to person, but these are the sorts of patterns that we've seen. So that's your mood and emotions. The thinking is a real characteristic sort of, there's an essential sort of quality to the thinking of a depressed person. So they tend to focus on negative difficulties and problems, whether that's within themselves or within their relationships or even in society. They might become fixated on some of the difficulties in our world and around us. But with a real bias towards it being problematic, and there not really being much hope, and it's likely to stay like this and nothing's ever going to change, and almost spiralling down to a what's the point, which of course, you know, tends to make that person just withdraw from the more proactive answers and problem solving that we would do when we're healthy. So the thinking is a real sort of classic indicator of depression. And of course that sort of thinking has the effect of maintaining the depression, because it's very difficult then to challenge that thinking if you are also withdrawing and isolating yourself. So in terms of the behavioural changes, this is what tends to happen, is that you don't sleep as well, or you want to sleep a lot. Your appetite might start to change, interest in sex might really drop off as well, and of course this sort of tendency to want to withdraw from people and disengage from the things that you might normally do. There's generally a drop in energy as well, and drop in motivation, so you're not really feeling like wanting to do the things you used to do. And all of these symptoms of depression tend to have the effect then of maintaining the depression and sort of getting you stuck in this place that's pretty hard to get out of.